Social nurse web. Presence. Antibiotic premedication for patients undergoing dental procedures. Premed guidelines for patients with specific cardiac conditions. Background. The following dental procedures are considered to have the greatest potential to produce a bacteremia, i.e. procedures which manipulate the gingival tissues and which may cause bleeding and the presence of viable bacteria in the blood. Periodontal procedures including surgery, scaling, root planing and probing interligamentary anesthesia injections. Subgingival placement of antibiotic fibers or strips. Polishing of teeth or implants, where bleeding is anticipated. Initial placement of orthodontic bands, but not brackets. Prophylaxis is recommended for all dental procedures that involve manipulation of gingival tissue or the periapical region of the teeth, or perforation of the oral mucosa. Current medical practice indicates that dental clients who are at risk for infective endocarditis, i.e., should have prophylactic antibiotic premedication prior to specific dental procedures, including procedures regularly performed by dental hygienists during the assessment, implementation and evaluation phases of clinical client care. 1. Artificial heart valves. 2. A history of infective endocarditis. 3. Certain heart conditions present from birth including a unprepared or incompletely repaired sciatic congenital heart disease, including those with palliative shunts and conduits. B. A completely repaired congenital heart defect with prosthetic material or device, whether placed by surgery or by catheter intervention. In this case, prophylactic antibiotics are only required during the first 6 months after the procedure. Any repaired congenital heart defect with residual defect at the site or adjacent to the site of a prosthetic patch or prosthetic device. 4. A cardiac transplant that develops a problem in the heart valve. Key changes for patients with congenital heart defects. Preventive antibiotics are no longer recommended for any other congenital heart disease than these. Sciatic congenital heart disease, birth defects with oxygen levels lower than normal, that has not been fully repaired, including children who have had a surgical shunts and conduits. A congenital heart defect that's been completely repaired with prosthetic material or a device for the first 6 months after the repair procedure. Repaired congenital heart disease with residual defects, such as persisting leaks or abnormal flow at or adjacent to a prosthetic patch or prosthetic device. Adult and pediatric dosages of Premed antibiotics. Oral amoxicillin, 2G adults. 50 mg per kilogram children. Unable to take oral. Ampicillin or ceftriaxone or ceftriaxone. 2G IM or IV adults. 50 mg per kilogram IM or IV children. Allergic to penicillin or ampicillin oral. Cephalexin 2G adults. 50 mg per kilogram children. Clindamycin 600 mg adults. 20 mg per kilogram children. Or azithromycin clarithromycin 500 mg adults. 15 mg per kilogram children. Allergic to penicillins or ampicillin. And unable to take oral medication. Ceftriaxone. 1G IM or IV adults and 50 mg per kilogram IM or IV children. Or ceftriaxone or clindamycin 600 mg IM or IV adults. And 20 mg per kilogram IM or IV children. Timing of antibiotic administration. An antibiotic for prophylaxis of a cardiac condition should be administered in a single dose before the procedure. If the dosage of antibiotic is inadvertently not administered before the procedure, the dosage may be administered up to 2 hours after the procedure. However, administration of the dosage after the procedure should be considered only when the client did not receive the pre-procedure dose. Wilson et al. 2007. Total joint replacement. In 2012, the American Dental Association and the American Academy of Orthopedic Surgeons (AAOS) released the first co-developed evidence-based guideline on the prevention of orthopedic implant infection in patients undergoing dental procedures. One of the guideline recommendations suggests that the practitioner might consider discontinuing the practice of routinely prescribing prophylactic antibiotics for patients with hip and knee prosthetic joint implants undergoing dental procedures. Grade of recommendation, limited. References: American Academy of Pediatric Dentistry. Guideline on antibiotic prophylaxis for dental patients at risk for infection. Internet. 2011. Wilson W. et al. American Heart Association Guideline. Prevention of infective endocarditis. Circulation. 2007. Thanks for watching. If you liked this video, comment, like, share and don't forget to subscribe. Animated and put all together by AL-Mohtar, RN, BSN. Master Certificate in Healthcare Leadership, focus on organizational change. Executive Certificate for Healthcare Professionals.